Hi everyone. So it's been long, and I'm happy to be back with you guys. So I wish we discuss about pelvic inflammatory disease. This is a condition I've seen it common in the clinical regions. Most women suffer from this, knowing and unknowingly, and I wish that we may learn something about it today. So, what is pelvic inflammatory disease? Well, this is an infection of the upper female reproductive tract, including the uterus, fallopian tubes, and ovaries. And it can extend to surrounding pelvic structures and the pelvic peritoneum at times. So, it's most commonly caused by sexually transmitted bacteria like chlamydia and Neisseria gonorrhea, but it can also involve organisms associated with bacterial vaginosis and other polymicropathogens. So what I mean is this: PID is not transmitted by men to women. What normally happens is you get an STI, and either you delay treating it or you just ignore it, and you end up with a pelvic inflammatory disease, in short, PID. So normally that is what happens. So what are the causes of PID? As I've said before, sexually transmitted disease, which is the leading cause, and other bacteria, including those linked to bacterial vaginosis, can also contribute. Now, what are the symptoms? The most common symptoms you'll find are low abdominal pain, often bilateral. The pain you feel below your umbilical, okay, below the umbilicus, hapa chini. That is where you feel pain. Abnormal vaginal discharge, often mucopurulent or yellow green. Mucopurulent, I mean the vaginal discharge is mostly mucus, and it can turn to yellowish greenish color in chronic, if it's more chronic. Another symptom is irregular vaginal bleeding, especially during or after menses. You find yourself bleeding after your period. Okay, you finished your period, you go like 2-3 days, then you see some spotting again. That is also a sign of PID. Fever and systematic signs of inflammation. You may tend to have fevers on and off, together with chills. You may also have cervical motion tenderness on examination. So whenever you go for examination down there, you find it very painful. That is also a sign of PID. Nausea, vomiting in severe cases. There's also painful intercourse, which we, in medical terms, we call dyspareunia. Whenever you want to meet your partner, you find it very painful and you don't enjoy sex at all. Dysuria, this is when you have painful urination. When you go for the short call, it tends to be very, very painful. Some patients may be asymptomatic and have mild symptoms, even with significant inflammation. So not everybody will present with this. Some don't even have the symptoms, but they still have the PID. So how do we diagnose this? Number one, you need to do lab investigations whereby you check for STIs. Another thing we can do is imaging ultrasound, whereby we check your pelvic region and see whether there is a cases of inflammation or any other complication. So how is this PID treated? Is it treatable? Yes, it is. You take a course of antibiotics for about 5 to 7 days. Very strong antibiotics that will help you clear the bacteria. As I said, it can be caused by STIs. So the antibiotics that are used to clear the STIs can also be used to treat this PID. Antibiotic regimen may be adjusted based on severity. If it's very severe, then you can be treated for more than 7 days. Hospitalization may be needed in severe cases and complications. There are those who are very sick, those who are even having pus in their vaginal discharge. They're having vaginal discharge which is pussy. So these are the people who need to be admitted in the hospital, or those who are having very severe pain. They can be admitted in the hospital for a few days for the course of treatment. So what are the complications of PID? Number one, most common, is infertility due to scarring of the tubal, due to scarring and tubal damage. At times, PID can lead to the blockage of your fallopian tubes if not treated. So if you want to conceive, you find it hard because your tubes are blocked. Ectopic pregnancy, increased risk due to tubal damage. So once your fallopian tubes are damaged, you have a high chance of having an ectopic pregnancy. Chronic pelvic pain, you're always in pain. You can also end up with an abscess of the tubo-ovarian abscess, whereby the ovary tends to get an abscess and it is very painful. The risk of complications increases with delayed diagnosis and recurrent episodes. My dears, have one sexual partner. This thing of you having so many sexual partners here and there, it's risking you to ending up having STIs, hence PID. So how do we prevent? Early diagnosis and prompt treatment of STIs. Do not sit at home when you have STIs. Go to the hospital and get treated. Safe sexual practices including condom use. Yes, if you have to sleep around, then use a condom. Kindly. But I advocate not you sleeping around. Regular screening for STIs is also important. Go do a checkup. So, PID is a leading preventable cause of infertility in women of reproductive age. So kindly, if you love yourself and you wish to have babies in future, take care of yourself. Many women may have mild or no symptoms, leading to delayed diagnosis and increased risks of long-term complications. You might not be able to conceive if your uterus and fallopian tubes get damaged by this disease. Okay. So what are the key long-term risks? Including fertility, as I said, ectopic pregnancy, peritonitis, adhesions. So infertility, this is whereby you get blocked or damaged tubes that prevent pregnancy. Ectopic pregnancy, embryo implants in tube, which is life-threatening. Chronic pelvic pain, so this is the persistent pain due to scarring or adhesions. Tubo-ovarian abscess, as I said, pus-filled mass may cause severe damage. It can. Recurrent PID, increased risk of repeat infections. Treat yourself. Anything funny you see down there, just go to the hospital for clarification. Don't wait for it to be worse. So I think you've learned today something, and I hope you're going to take care of yourself, love yourself, and everything will be fine. Don't have so many sexual partners, and if it's a must, then you must use protection. Otherwise, be safe and love yourself.